Okay, so today's discussion is reversing high blood pressure, high cholesterol, and heart disease. And I got you all here with those buzzwords because those are the kinds of things that people kind of most commonly understand or think they kind of understand. So those are the things that your doctors are trying to make you afraid of. But if I were to more properly name this discussion that we're about to have, I would call it reversing metabolic syndrome. Because yes, we're going to talk about reversing high blood pressure, high cholesterol, and heart disease. But if you can focus on reversing metabolic syndrome and understand that, you'll be reversing those things and a whole lot more, which is what I actually do when I teach people how to eat in a way that does that. So, and reversing metabolic syndrome includes reversing cancer and dementia and autoimmune disease and all those things. But today we are going to just focus on the aspect of it that involves cardiovascular disease. But understand that what I do here is totally reverse the entire syndrome. So last week we talked about first reversal in terms of weight loss, because that's the sexy part, right? Like the thing that people most drag themselves to me to find is the weight loss. But you need to understand that I consider that just a wonderful kind of side effect of how we eat. So when people aren't seeing the weight loss day to day, because everybody thinks that they're going to lose a pound a day and it's going to happen just like that. But you guys know that it doesn't work exactly like that. The weight loss comes in time. And very often I'm having to remind people that what you're seeing on the outside is just a reflection of how healthy you are on the inside. So as you're seeing my clients get healthier and happier and they're approaching their healthy weight, what's really going on that's more important is they're cleaning their health up on the inside. So obviously, since I'm a physician, I lead you down a path of happy weight loss, but what I'm really doing is bringing you the most health benefit just from eating. And that's what I did for my husband, and that's what I did for my friends. And that whole story from last week, so I'm not gonna drag you into that. But what you may not know is that I started this whole thing for Adam, right? I started this whole thing for my husband. So I knew when I married my husband that he had a terrible family history of heart disease, like bad. Everyone in his entire family ahead of him, by the time they were in their 40s, was on all the medications to prevent heart disease. And by the time they were in their 50s, they were all having bypass. So, and like his mother has had multiple bypasses now. So I knew that when my husband was getting into his 40s, he was becoming very high risk. And so at that time, we connected him up with a cardiologist, like everywhere that we moved over his lifetime. Every time we moved, one of the first things we found him was a cardiologist. Because if you know what you're going to die of or what's going to become your problem, it behooves you to know the specialist in your area that you're going to want to use. So rather than like dying on their doorstep one day and be like, hey, you don't know me, it's nice to be connected so that when you're talking about all your risk factors and what you know is going to happen to you, you just call them on one day and be like, yeah, today is the day and I need you now. So my husband was linked to a cardiologist beginning in his early 40s here in our area. And you can see I listed the risk factors for heart disease here and at least 10 of them that we know. And, you could probably add some others like, what don't I see here? Like just living in a city and that type of a smog and that kind of stuff. So there's a lot more risk factors, but these are the main 10, right? And of the 10, Adam had at least 6 of them building. So he had the family history of heart disease. He had high blood pressure. He had high cholesterol. He was treated for both of those things beginning in his late 30s. He was gradually picking up weight. We were both becoming overweight in time. He had a pretty unhealthy diet and he was drinking too much on the weekends, as many of us do. Many of our husbands do as well. He was not a smoker, thank God. If I could tell everyone out there, if there's one thing and only one thing that you do to avoid heart disease and cardiovascular disease, it is quit smoking. So that's a major, major one. Physical inactivity and stress. You can't argue if you know my husband that he's ever stressed, because he's not a stressed out guy. So that was not part of his, but he had 6 out of 10. And I knew that he needed some help. And so that's why I started this whole business of figuring this stuff out. And of course, you guys know that he was not the first to jump on board with following me. Hello, hello. I had to get Sharon to do it. And once he saw all the changes that were going on in Sharon, he was like, okay, obviously you guys have something. So, and you know, you can't always control everything, but you should control what you can. So in his case, he thought he couldn't control his family history of heart disease. And that is true, that you can't change your genetics. However, many people that work with me realize a lot of the times when they're worried about something familial like heart disease, that your shared history is not just your genetics, but it's a shared way in the way that you eat. So if you're just changing the way that you eat, and you're improving all this stuff, you can in fact change your family history in a lot of ways. So it's not always just genetics that's adding up. So anyway, just so you know, so you'll see my hubby did finally jump on board, and in a few months time, he lost 25 pounds. So you see the difference here. He lost 25 pounds. His high blood pressure dropped almost overnight. He corrected his cholesterol, and he fixed a few other things that were going on as well. But essentially, 8 years later, was back at his cardiologist and just checking in again. And eventually she told him, the best cardiologist in our area told him, he was wasting his time in her office. Like she essentially kicked him out. He did not need to come back. He had 0 risk factors going forward. So cool, right? So I just want you to know, like, that this hits home. As we talk about this is not just me talking about you and your risk factors, but this hits home. And all of us have risk factors for heart disease, as you know. I have them in my family as well. This is my brother, Patrick. My brother didn't just have heart disease, but he had all of the metabolic syndrome, including diabetes, the overweight and everything. And we'll look at that in a second. And here you see his progression over a couple of years, and this is him living his best life now because he's cured. And my brother is one of those people who was so high risk that when anything happens to him, they automatically want to look in his heart. They're like, oh, it must be your heart. Let's look inside. So since he's been on my diet, they have had a look inside my brother's heart, and his arteries are completely clear. I have many clients like that, just so you know. And I know I'm always crossing my fingers if they're headed into heart surgery that their arteries are going to be clear. But I know for a fact, if they've been on track the way they said they have been with their low carb diet, those arteries will come out clear. And I've had many clients say that to me now. And I love that. I love it every time. So just want you to know, as we're talking about this stuff does hit home for me. And I've had some close saves very close to home, thanks to how I'm teaching everyone that I love to eat. So, okay, here's the first thing you need to understand about cardiovascular, or heart disease, I should say. Heart disease is part of a bigger umbrella called cardiovascular disease. So I'm sure you hear that term as well. And you may or may not know what that means, but cardiovascular disease is the disease that encompasses all of your arteries. So if you've had a heart attack, we know for certain that you are at high risk for heart failure. We know for certain that you're at high risk for stroke, high risk for kidney disease, because if you have a problem in your arteries in one place, you have a problem in your arteries everywhere. So some of you may know people who have had problems with feeling cold in their feet or cold in their legs or pain in the legs. And that is much like the pain of a heart attack when we don't have very good blood flow to the legs. So many of you may know people who have had bypasses in their legs and arms. That is called peripheral arterial disease. So in the periphery of your body, the same type of disease that we see in our heart. So all of these things, when we say you're at risk for heart disease, know that you're also at risk for all of these things, including stroke. So when we're trying to reverse heart disease, we are trying to reverse all of these things, being at risk for all of these things. Okay. So here's again the risk factors for heart disease. So you see them. These are the ones that you saw next to Adam, 1 through 10, right? And then I'm going to help you understand why I'm always focused on metabolic disease, not just heart disease. So I ripped out a page from, Jumpstart is coming up, right? So Jumpstart Sugar Detox is coming up in January. It's going to be your next chance to get on board to start doing this stuff if you're not already my client. So this is just ripping out a page where we're talking and learning about metabolic syndrome, okay? So metabolic syndrome is not just the high blood pressure, not just the weird cholesterol stuff, and we'll talk about this, but it's also high blood sugar. And this isn't just talking about diabetics, okay? We're going to focus on that next week. That's next Wednesday's lecture. We're going to focus in on that diabetes and sugar and understand why lowering blood sugar is not just important for diabetics, but for all people, because it's that sugar which causes all the inflammation in these arteries and causes all the problems. And then part of metabolic syndrome is also the excess fat around our waist, which is also wrapping all of our organs and choking off all of our organs. So that's metabolic syndrome. And we know that if you have just one of these things, you're on your way to having all the rest of them develop. If you have just one of these things, you're at risk for heart disease. But if you have 3 or more of these things, essentially you have the syndrome. If you have 3 or more of these things, we know you're at very high risk for heart disease and stroke. So, and it's estimated that about 35% of all Americans have metabolic syndrome. And for most of us, it starts developing. Most of us have 1 or 2 of these things developing by the time we're in our 30s. And for the younger generation, that's actually much earlier now. Most teenagers, have at least 1 of these things developing. So, okay, so now I'm going to put them together just so you can see why I focus on decreasing or reversing metabolic syndrome. Because if you look at metabolic syndrome and the 5 things there, they end up being the first of the first 6 of the risk factors for heart disease are wrapped in metabolic syndrome, okay? So by lowering the amount of sugar in your diet, you start checking off, like I'll go in reverse. You start checking off all of these things. You get rid of the unhealthy diet right away by dropping your sugar. The overweight starts to go away. And I'm going to show you we have some proof in our lab work today. Ann sent me her labs, which included some of her fatty liver disease, and we erased that in a few months. So the overweight goes away. We lower the blood sugar within days. So when I have a diabetic working with me, somebody who's actually checking their blood sugar daily, they're always shocked that within like 2 or 3 days, we're taking them off their meds. Same goes for high blood pressure. When I have people that are working with me, and this is almost all my clients, I'm going to say 50% of my clients are on high blood pressure meds. We're reversing those meds within like the 3rd or 4th day. They're telling me my blood pressure is too low and we're getting off those meds. And typically within the first few months, they'll be completely off of those meds if they're following the diet day to day, okay? All right, so let's take a closer look at the cholesterol. Because I know the cholesterol is the confusing one. And that's because what we know about cholesterol has been changing really rapidly over time. And I think we all have this understanding that like we've known about cholesterol for centuries, but no. No, it's only been for a very short amount of time that we understand cholesterol. And pretty much our understanding of it we started looking at this problem in the 1950s. And we started looking at it because we had a sitting president had a heart attack. So some of you that have rarer disorders know that some of the sadness about having a disorder that's rare is that not a lot of research dollars get sent in that direction. But if you're lucky enough to have somebody in a high-seated office in government, or a famous person, or somebody that's just a multi-millionaire in and of themselves, you're going to have a lot of research dollars head in that direction really fast. So in the 1950s, President Eisenhower had a heart attack, and we started cutting open hearts to figure out what's wrong. When you cut open a cold heart, what it looks like, if it is diseased, is a bunch of fat. So that's where we started. Immediately we felt like, okay, it's fat, we have to cut the fat. But that's not how our bodies work. Okay, when we eat fat, the fat that we eat gets broken into tiny tiny little infinitesimal molecules that then get sucked up into your bloodstream and look nothing like fat at the time that it gets absorbed, okay? So, but that was our understanding in the 1950s. So in the 1950s, we said, stop eating red meat. But heart disease kept rising. So after that, we knew there must be something else. So we looked at the fat a little bit closer and then decided, okay, when we look at blood vessels in a beating heart, one that's still alive, the fat doesn't look like the fat that's next to your red meat anymore. It starts to look more like butter. And I know you guys have seen that, like when they cut open arteries and like, look, there's the butter, stop eating it. So once again, though, that is not how our bodies work. When we eat butter, it doesn't go straight into our bloodstream. In fact, the only thing that can go directly into our bloodstream from underneath our tongue, right into our blood vessels, is sugar, okay? So fat doesn't work that way. So, but we thought, okay, it must be saturated fat, get rid of the butter. So off our list of what to eat came butter. And we went to margarine. And you guys know the whole, you can't find margarine anymore. Why? Because we know for certain that it causes death. So that was not the answer. So then when heart disease continued to rise and rise and rise, we discovered, oh, there's something within that saturated fat within that butter, and it's cholesterol. And we didn't start taking a close look at cholesterol until like the 1980s. So when I was in medical school, this cholesterol business was like new stuff. And we still don't learn a whole lot about cholesterol in medical school. In fact, most of the doctors that you guys are talking to out there learn about cholesterol from pharmaceutical agents, and all they know about it is from a pharmaceutical agent. If you want to talk to a cholesterol specialist, that's not your doctor, that's not your cardiologist. Cholesterol specialists are called lipidologists, and lipidologists number in the 10s and 20s. So there's probably about 10 or 20 of them across the world, not just across our country. So just so you know, this is a tiny little disease that only very few people know a ton about, okay? So when it wasn't the saturated fat and we went to total cholesterol, then we started telling people to stop eating eggs. So this stuff was actually happening. Like, they love to say that, like, if people had followed our advice, it would have worked, but that's not true. Because if you look at the amount of red meat, the amount of butter, the amount of eggs that got purchased in our country over all those years that they started telling us to stop eating them, we were not eating them. People stopped eating them, and yet heart disease went up. Okay. Then we learned after that, in the next decade, we learned not just about total cholesterol being a problem, but then we discovered LDL versus HDL. And this is as technology improved, as our ability to see these things on a microscopic level got better and better, to now we're at the point of understanding that it's not any longer just LDL versus HDL. It's now even smaller particles that we're worried about, specifically triglycerides and VLDL. And we'll look at those when we look at your numbers today, guys, okay? But our understanding of cholesterol, has changed so much. We now know our body makes cholesterol. So the
That's what
cholesterol
people said in school. Yeah. Oh.
Hey, Mom.
Oh, I'm sorry.
That's okay. I got you. I muted you. So we now know that the cholesterol inside our bodies doesn't come from what we eat. It comes from us making it. Cholesterol is so very important to our bodies that we make it every hour of every day. And our cholesterol makeup can change every hour of every day just based on what we eat. So, and cholesterol is part of every single cell. If you take a look at your children's or grandchildren's cell membrane when they make them, it's all filled with cholesterol. And cholesterol is also part of every hormone. So the cutting out of cholesterol and the decreasing of fat in our diet over the last decades has led to a lot of hormonal problems, including a lot of fertility problems, which is like another discussion for another day. But if your doctor is talking to you about a problem with your total cholesterol and telling you need to be on medicine because your total cholesterol is high, without any further explanation, that is a dinosaur doctor. I need you to run away from that doctor. It is somebody that does not understand what's happening in today's day. So what we talk about today is not high cholesterol as being a problem. It's a word we call dyslipidemia. Dyslipidemia is the problem that we should be looking for as doctors. And it is the problem that many of our labs recognize. So when I have people send me their cholesterol labs and say, my doctor is scaring me, they want me on meds because my cholesterol is high, very often I can look in their lab work and say, look, your own lab told you based on your numbers that you're okay. So your doctor doesn't know what they're talking about. So this happens quite a bit. I'm going to show you somebody that happened to today who sent me her numbers. So, okay, dyslipidemia is very specific. It means your triglycerides are high, what we now call the bad cholesterol. So don't let your doctor tell you that the LDL is the problem anymore. LDL is what your statins will drop, but that's not ideal. Ideally, you want your triglycerides to drop, and you want your HDL, your good stuff. HDL is still the good guy. So we want our HDL to be as high as possible. So a bad cholesterol profile is one that has high triglycerides and a low HDL. And what do we do to make the triglycerides drop and the HDL rise? We eat less sugar. It's as simple as that. You eat less sugar and you'll see this change within a matter of months. And you'll see your entire profile and your risk factor based on cholesterol alone change completely. So, all right, I know you guys know that Jumpstart's coming up. This is where I teach the sugar detox. It's my newest program. It's going to start in January, but it's going to go on sale the end of this month. And that's why I've been like harping on trying to help people understand what all I do with this Jumpstart and this reversal of heart disease is just those one things. Okay. So you get the 14 days of interactive coaching virtually by phone with me. You get to be on my app with your whole team. You'll see my videos. You'll be with me in live conference like you are today. You'll get a coach. You get all the teammates, right? We talked about this last week. You get all these gifts. So the ability to shop with me and understand what groceries you should be taking off the shelf and what you leave behind. You'll be able to have everything that you need to stay on track. That includes my cookbooks and what to be doing in the kitchen. You also get me coaching you personally through sugar detox, because we are all addicted and there's a bit of trickery that's involved with making that easier. Okay. So I showed you this last week. All of this stuff we value to be like $3,000. I'm with you full time through this adventure. So you guys know I'm with you full time. But my normal price for that is going to be about $300. So about 1/10 of that price. Okay. So, or about the cost of like your cholesterol medication for the year, which you won't need anymore, including all your other meds. You will not need anymore. But you know that I'm having a sale on Small Business Saturday, which is November 30th. Please write that down. Please invite your friends. Please send them this video when I send out this recording so they understand that this is just an infinitesimal, like little piece of what we do, but reversing heart disease is a major part of what we do. So for just $99, you're going to get all of that on Small Business Saturday. So make sure that your friends know about that. Okay. So let me jump into sharing. Okay. Some of you are saying hi to me in the chat. If you're here and you're listening, please put your name in the chat, because you guys know when I'm done with doing this cholesterol business with you, I'm gonna choose a name out of the chat for our winner, right? All right. Let me share this other screen with you. If I can share my whole screen, I can teach you how to do your cholesterol stuff. Okay. So I told you, a lot of you sent me your numbers ahead. I can't do absolutely everyone today, but I do have some of our numbers up. Anne, are you with me? I don't know if she's here. I'm going to skip Anne's numbers because I went through them myself and I think I'm not reading them clearly. Sometimes when you guys send me your numbers, I get the page, a picture of the page that your doctor sent you home with, and it's all highlighted, and they've highlighted through like the fresh ink, and the numbers are are messed up. So I think Anne's second line of numbers are not right here. But we can talk about this in Fix Nation if I can get Anne's her second line right. What's important for her is she came to me with fatty liver disease, and that's reflected here in her AST and ALT numbers. So her AST and ALT were 139 and 192, and now are 41 and 47. And these are a difference over just 4 months. Anne started with me back in June. So what that's showing is she had fatty liver disease, which is one of the major objective findings that you can see for metabolic syndrome. And she basically just erased all that fat, all that internal fat is gone. So amazing. And it's looking like her cholesterol is better too, but I don't trust that I'm viewing her numbers right. So I'm going to skip to Linda. Okay. So, I got to show you something else. I got to show you where I'm finding my things. Let me go here. Let me open this up. Okay. I think you guys can see that. So where am I? I am at emergencyhealthfix.com. Okay. Up in the menu, can you guys see that? I think so. You'll find my blog. So if you click on the blog, you'll find just everything you want to know about. So anything about exercise is there. If you want to learn about time restricted eating, it's there. If you want to learn about fasting, it's there. If you want to know about what I think about Ozempic, it's all there. So if you want to know how to do this as a vegetarian, so there's tons and tons of stuff in my blog. Okay. So if you're looking for a specific thing, you just go up into this little search. I'm going to search on cholesterol. I'm spelling it wrong. Cholesterol. And if you have your number, if you're coming to this blog, I have multiple about cholesterol. So I would love for you to read all of it because then you'll see that I'm not making this stuff up. I get my numbers and the way I interpret your cholesterol. I have learned from the lipidologists, the people that understand how to understand cholesterol. So if you open these blogs, you'll see all my links to them speaking live, to their podcasts, to their books. They're all in these, okay? But if you have your cholesterol numbers in hand, the one I want you to open, you don't need to do this just now, but in the future, anytime you have your labs, anytime somebody else is worried about their cholesterol, you can bring them to this blog or show them this blog. I'm going to open the one up that says measuring your risk. The one with measuring in the name is where you're going to find the rules. So it's called high cholesterol measuring your risk. I'm just going to scroll down. I know you guys can't read this because it's way too small, but it's like a lot of words. And then down here, you see numbers 1 through 6. Okay. And this is what you follow. These are the rules that you follow. And we're going to do that right now together. So the 1 through 6 is what you're going to see on my Word document here. So let me bring that up. Okay. So see, I have rule number 1, rule number 2. We're going to go through that. I have Linda's numbers. I have Trisha's numbers. I'm going to skip Anne. Sorry, Anne. If you were here, I would make sure I had those right. Okay. So rule number 1, this is from that blog. Okay. So if you have your numbers in front of you, you can do this with us. Okay. Rule number 1 is you are low risk for heart disease. This is just based on cholesterol. Remember, there's 10 risk factors, but this is trying to decide, are you at risk based on your cholesterol alone? And do you need cholesterol medication? Which I want to argue, no one needs cholesterol medication and the risk factors if you just eat right, okay? So you're at low risk if your triglycerides, those are the bad guys, are less than 45. So in parentheses, I said, in fact, you stop right there. If your triglycerides are less than 45, you're done. Don't look at anything else. Don't listen to anyone else. You are done. You are so safe. You have 0 risk for heart disease if your triglycerides are less than 45. I will tell you, that's hardly anyone that I've ever seen. So, but you are done. So, Anne, based on your triglyceride alone, no, you have to move on. Linda, no, you have to move on. Trish, so Linda is 92, Trish is 116. Those are their triglyceride numbers, okay? So don't get upset if you have to go beyond rule number 1. That just means there's 6 rules here. If you can mostly clear all the rules, you're in the clear. But if you got number 1, you're done. Most people do not have number 1, even me. So, okay, then we go on to number 2. Let's see if we can figure it out based on number 2. You are also low risk if your HDL is greater than 55. So let's take a look. HDL, the good stuff, is very protective. So Anne, based on your numbers, you're low risk. Linda, you have 66, you're low risk. Trish, 63, you're low risk. Okay. I never like to leave it at just one, right? So based on number one, we were not in the low risk category. Based on number two, we are. Okay, so would you like to see more? I would like to see more. If it were me, I want to see more. So we go to rule number three. You're low risk if your triglycerides over HDL is less than 2. Okay, so now you have to do a little math. All right, I have my calculator here. So low risk if your triglycerides over HDL is less than 2. So Linda, here we go. Triglycerides for you is 92 over your HDL 66 is 1.39. You're less than 2. That means you're low risk. Yay. Okay, so let's do it again. Trish, your triglycerides are 116 divided by your HDL, which is 63. 1.8. If it's less than 2, you're low risk. So yay, okay? All right, that's rule number 3. Rule number 4. Now, this is the one, if you look closely at what comes back from your lab, don't just look at the ones they highlighted and the ones that they marked in red and the ones that, okay, look at everything on that page, because very often these labs will measure your total cholesterol over your HDL. And if it's less than 5, your lab will tell you that you're safe, right? Okay, so let's go back up to our girls. Linda, in your lab work that you sent me, you sent it direct from your lab, you had this number. So your lab told you your cholesterol over your HDL is 3.3. So I don't have to calculate it here. Your lab told you. Less than 5 is our number for you are safe. So I certainly hope, I don't know, I don't know in your case if your doctor wanted you to be on cholesterol medicine, but in your case, your lab is telling you that it's not indicated. And that happens with a lot of people. It's amazing how many people tell me, oh, I have really high cholesterol. Because if you look at, Linda has a cholesterol of 220, right? So if you follow this rule, this old rule that says high cholesterol, therefore you go on a statin, she'd be on a statin and her doctor would be recommending that. And that's wrong. She is not high risk. Okay. So, okay, Trish, if we're following that rule for you, your total cholesterol is 197 over your HDL, which is 63 for you. Oops, I did that wrong. Sorry, guys. 197 divided by 63, and you're 3.1. So anything less than 5, according to this rule, you're low risk. All right, I hope you're feeling better. If Linda and Trish are with me, I hope you're feeling better. I think Trish just told us on SWAT team that she's having trouble with getting in because of a problem with her internet, but she'll see this later, I know. So that should make you happy, okay? Already you have 2 rules down, and both of those rules are saying you're low risk. So now there's more, right? If you you're not convinced yet, there's more, okay? So now we go to rule number 5. You're also low risk if your LDL over your HDL is less than 3.5. Okay, go back, bring up my calculator. LDL for Linda is 134 over HDL for Linda, which is 66. And we have a number of 2, less than 3.5. You're good. So, right? Okay, and then Trish, LDL over HDL, we have 114 over 63. 1.8 is less than 3.5. You're good. Yay. I love doing these. I love doing these, especially with my clients that have been on track, because I always get numbers. And a lot of times you'll scare your doctors because for many people on a low carb diet, your cholesterol will go down. But for some people, the total cholesterol will go up. For some people, those LDL numbers will go up. But like I just said, we're not concerned about just those anymore. That's an old way of thinking about cholesterol. What we're really concerned about are those even smaller things, the triglycerides and the HDL. So, and if you take a look at those blogs, you guys, you want to know how to get the triglycerides lower, how to get the HDL higher. Number 1 always is lowering sugar. But there's a lot of other tips in there as well. If you want to work on those even more, there's more than just lowering the sugar that you can do. Okay, the very last thing here is a little bit difficult because you have to know your rules of operation for your order of operation for math. So you're going to take your total cholesterol on this last one minus HDL plus LDL. So you got to add up your HDL and LDL first and then subtract it from the total cholesterol. This is called remnant cholesterol. It's a very high level way of looking at your cholesterol and your risk. If your remnant cholesterol is less than 30, then you're low risk. And if you want to know about how to do this and how to calculate it and even watch a movie about it, it's in that blog where I talk about these things. So at emergencyhealthfix.com, in the blog called Measuring Your Cholesterol, Measuring Your Risk, you'll find this stuff. So I already did these ones for you guys because it takes a little bit more complex math. So let's see, Linda, you came out to 23 and Trish, you came out to 20. So your remnant cholesterol is puts you both in the safety zone. Yay. All right. I'm going to stop share if I can figure out how to do that. So I hope if you brought your cholesterol numbers with you, you're able to do this. If not, you can go to the blog. Do any of you guys have questions about that? Some of you that are with me are really, really healthy and maybe what we call an LDL hyperresponder. I know that's myself. I know that's Monica. I know that's my sister-in-law, Sandy. I know also my sister-in-law, Marilyn. So some of us that are really healthy, that get lean, that are now getting muscular may see that LDL jump. And that's a special level of healthy, actually, that's newly being understood. So if you have numbers, I'm always having people contact me like, oh my God, my doctor's scaring me again. If you have numbers that are scaring you, you can always look at my blog, calculate it for yourself. If you're still not certain or uncertain about what you're seeing, please just send them to me. I'm always happy to look at your numbers. All right. And what else? Oh, last thing. Next week, remember, we're going to be talking about diabetes, how to lower your blood sugar, why lowering blood sugar is important for everyone, not just those with diabetics. So people that are trying to get to the highest level of health are often trying to lower their blood sugar and wearing glucose monitors, which I'll be getting into this year with my friends. So, all right. I see a lot of you in this chat. All right. I'm going to write it down. I'm going to write it down and then I'm going to pick somebody. Are we ready? I got Beth. I have Trish. I have Cindy. Okay. I have Maureen, Linda, Michelle, Trish. Oh, Trish, you made it. Good. Stacy's here. My other Linda. Okay. Roxanne, Luann, Debs. I'm glad to see you guys. Nicole's here. Kelly's here. Okay. All right. I think I got you all. Okay. Here we go. This is how we're going to do it. I have all your letters of your first names. You see them? Okay. Oh, Fran, I see you. Okay, here we go. I'm going to drop it down. Closing my eyes. I'm going to pick one. Okay, Linda, it's Linda K. So, congrats, my friend. You just won a $25 gift certificate to Amazon. And thanks for being here. And thanks for being my client for a long time. You've been a supporter for a long time. A lot of you have. All right. Let me know if you have any questions about this, you guys, and I will see you next time for learning all about blood sugar. Bye, my friends.